All right, so next I believe is a virtual presenter. This is Dr. Rajashri Manjunath. I'm sorry if I pronounced that wrong. Please correct me if I did. It will be presenting on analyzing resident perceptions of current radiation oncology evaluation methods.
Hello, everyone. My name is Rajashri Manjunath. I'm a second-year medical student at the AUUG Medical Partnership in Athens, Georgia. And today I will be presenting our research on the analysis of resident perceptions of current evaluation methods in radiation oncology. I'm just going to check here that I can indeed advance slides. There we go. So this is an outline of my presentation. I will start with a discussion of the background and purpose of the project and guide you all through the methods and results. Okay, to understand the relevance of this project, I believe we must first discuss the importance of radiation oncology or resident evaluations. Periodic evaluations during residency are designed to assess competence and ensure progress in a training program. Evaluations can help improve the quality of physicians graduating from a program and thereby strengthen the training program and facilitate growth within the field of medicine. The American College of Graduate Medical Education provides 6 core competencies that can be used to assess resident evaluations. These include practice-based learning and improvement, patient care, systems-based practice, medical knowledge, interpersonal communication skills, and professionalism. I want to take a moment here to define a few of these competencies that might not be so intuitive. Practice-based learning and improvement refers to a resident's ability to evaluate the care they provide and assimilate scientific evidence into their practice. Systems-based practice refers to their ability to function as members of interprofessional teams, provide cost-effective care, and respond to larger context of healthcare. Because of the importance of resident evaluations, it is important that we take a closer look at their current value, especially because studies in other fields of medicine suggest a need for change. Less than half of the internal medicine residents believe that their evaluations were extremely or very useful in informing them of their progress. 77% of orthopedic surgery residents in the study felt that 6 core competencies were not sufficient to assess their surgical skills. The field of radiation oncology provides a unique challenge in that it is multifaceted, combining both humanistic aspects of medicine with the skill-based approach that we see in surgical fields. There are also different components to radiation oncology training, including treatment planning and collaboration with dosimetrists and physicists that can make the evaluation process challenging. Since we face this challenge, it is even more important that we assess current evaluation methods, and that brings us to the purpose of this project. Here, we estimate the impact of current radiation oncology evaluation methods from the perspective of residents. We collect data to inform potential improvements, and thereby seek to facilitate positive change within the field of radiation oncology. To achieve the goals of our study, we created and distributed a survey to 13 different radiation oncology programs across the United States. Among other factors, survey questions were designed to gauge resident familiarity with evaluation methods, value of the 6 core competencies, the utility of evaluations, the likelihood of changing post-evaluation, and the stress or intimidation of receiving evaluations. Responses were reported on a Likert scale ranging from 1 to 5. Additionally, we were curious about the role of familiarity with evaluation methods and the perception of evaluations. So we used regression analysis to further explore this possibility. We received responses from 52 of the 104 residents we surveyed. Overall, residents were not familiar with the NEXT accreditation system and only slightly familiar with the 6 core competencies and the factors used to assess them. Residents perceive the competencies of patient care and medical knowledge to be the most valuable, while systems-based practice is the least valuable competency in assessing their progress and competency during training. Overall, residents agree that evaluations were useful in informing them of their strengths, areas of improvement, progress, and competence as appropriate to the level of training. 56% of the residents agreed that receiving evaluations was stressful, while 46% agreed or somewhat agreed or strongly agreed that receiving evaluations was intimidating. 79% of residents were likely to change behaviors and practices following evaluations. Our regression analysis found that familiarity with evaluation methods was not a significant predictor of the utility of evaluation methods, the stress of receiving evaluations, the intimidation of receiving evaluations, or the likelihood of changing post-evaluation. So what does this all mean? This all means that despite the low familiarity with evaluation methods, residents are likely to change following evaluations and still perceive evaluations as useful. And this highlights the positive value of current evaluation methods. Additionally, familiarity with evaluation methods was not predictive of the evaluation utility, stress or intimidation, or likeliness of changing following evaluations. So that suggests that there are alternative predictors of evaluation utility, stress, and intimidation, which we hope to explore in further studies. I just want to address that this study is a part of a larger project that seeks to develop a consensus for radiation oncology evaluations across programs. This time, I'd like to thank all our collaborators and all the institutions that contributed to this project. Thank you.